Yeah, I guess I didn't think about like the all the other things. So like what I I guess like when you have a hospital birth, it's like you get the sense like, oh, it's safer. Like, well, maybe. Or like
Maybe.
if there's complications, we can deal with it. Like probably. So like I don't, and I guess it just has like this maybe false sense of security, I guess,
Oh,
around
absolutely. Yeah.
going to a hospital versus like a home birth. Like, what if I bleed out in my bathtub and and I'm dead and whatever,
Yeah. Hmm.
whatever the traditional fears are. I guess I don't know. Um, but yeah,
Yeah.
I guess that's
There's,
why people go to the hospital.
yeah, people are definitely fearful of the worst case scenarios, and they're rare. And when they do happen, if you have chosen a licensed midwife or a certified nurse midwife, they have the experience, the training, and the equipment to handle anything that should come up. They have uh, pitocin for hemorrhages, just like the hospital would. They have, they're fully trained in neonatal resuscitation. In our area, midwives work together so that there's two midwives at most births, one for mom and one for baby.
Mm,
Um, so, and a midwife is the first one, a good midwife is the first one to say, we need to transfer this to the hospital. This is not something we can deal with here. Like they don't want
okay.
to be, they know their scope of practice very well and are like, nope, we need to move. And I'm going to stay with you and I'm going to be there with you the whole time. They bring all of your charts and records and everything. So your doctor has everything that they could possibly need. Um, so yeah, that's definitely the traditional fear. And then like society takes it a step further. And if you're choosing a home birth, then like, why are you being so irresponsible? Do you want your baby to die? And it's like, no, I don't. And I've done my research, and those are a lot of really intense accusations to throw at me, random person in the grocery store that asked where I'm going to have my baby. Like, simmer down. I just told everybody the hospital because I didn't want to have the conversation.
Sure.
Um,
I will
and deal
rip
with the
your head off
backlash.
right here in front of the bread. Like,
Like, literally,
do
get
not
out
mess
of
with
my
me.
life. Thank you very much. Um, but then, like, when you were talking about well, maybe there is some risk to the hospital, there's a lot of risk to every intervention that is um, performed outside of like normal physiologic birth. Every intervention has risks. They're well documented, they're well researched, and that is not something that anybody knows. Like when I was having TED, I was group B strep positive, um, which meant that as soon as my water broke, I was instructed to go into the hospital right away. And I was one of those people that had the like uh big dramatic water breaking all over the floor thing before any contractions or anything happened. So we're like, ooh, we're gonna have a baby. Let's go to the hospital. We drive the 40 minutes to the hospital. Nothing happens because I'm all jacked up on having a baby. I'm not resting. I'm not in a place that I feel comfortable where hormones can do their job. And we wait all night. I'm like up all night because I'm excited. I don't want to miss having my baby because like that would somehow happen. I'm like, no, I got to be awake. I'm gonna be here for it. And the morning came, and my doctor came in, who was a crunchy OB, and she said, Yeah, nothing's happening. Like you really don't have any contractions. So I think you need some vitamin P. And that was what was supposed to be my informed consent for induction with Pitocin.
Hmm.
So that carries a whole bunch of risks. And there were alternatives. I didn't know any better, nor do I feel like I should have needed to know any better. But I didn't know. I was like, okay, my doctor knows that this is what I need. And even the basics, like I was telling my birth story to people and they were like, oh my gosh, that must have hurt so bad. And I was like, well, I didn't know that going into it. I didn't even know that that would be more painful than natural contractions. I had no idea about inductions. Um, I just trusted her. So the induction turned into um, the epidural. I could not possibly stand it anymore. I went for like 9 hours with contractions every minute, lasting a minute, like no breaks. I looked in Dylan's eyes. I'm like, I'm not a failure if I get the epidural, right? And he said, of course not. Get the epidural. My blood pressure tanks and I almost pass out. And the nurse is like, well, you're laying down, so it's fine if you pass out. I'm like, thank you. That was helpful. Really appreciate that. And uh, then we start coach pushing. And the last thing that I hear before my baby's born is, you need to push this baby out, or I need to take him out with forceps or vacuum. Um,
Damn.
that is called the cascade of interventions. That exactly what I just said to you has a name because it happens so often to people. You start with a failure to progress, or nothing's happening, your contractions aren't doing what we want them to do. Let's give you Pitocin. You can't handle the pain. Do the epidural. Baby's not coping with labor well anymore. And thankfully for me, I got Ted out without vacuum or forceps, but oftentimes that also ends in a C-section delivery where a mom says, thank God I was in the hospital, because imagine what would have happened if I was at home. You would have had your baby in in a normal physiologic way, because you wouldn't have had the failure to progress that started all of that anyway. And what is failure to progress? Oftentimes it's not fitting in the timeline of what like the hospital wants. So there is risk to going to the hospital, and everybody should have deep discussions with a bunch of different providers to figure out which one is the right one for your specific goals and needs, and are they actually supportive of what you want. If they're going to use the words, I'll allow you to do that, I'm going to go somewhere else, because you're not going to allow me to do anything with my own body. Thank you. I would allow you to eat ice chips during labor, but you can't eat anything else. We don't allow water births. We don't allow you to be in the tub. No, thank you. No, thank you. Um, but the risks of the current medical model aren't talked about enough. And that's why I'm here as a doula, not to force everybody into a home birth. That's not it. I want true informed consent for every client that I work with, so that you know all of the options in front of you and say, this is definitely the right choice for me because I have all the information.
Yeah, it's all about choice. Yeah,
Yeah.
absolutely.
Yeah. If a
Sure.
mom wants to do a scheduled C-section and she has all the risks, benefits, and alternatives of that, and she says, yes, this is the right thing for me, let's do it. Sounds great.